Welcome to our virtual town hall. Thank you for being here. I'm your host, Josh Cutler. Before we start, I want to thank Providence for bringing all of these amazing voices together. And thank you to Dash Radio for giving us a platform. Let's meet our panelists. Why don't we start with you, Veronica?
Hi, my name is Veronica Pomete. I am a model, an entrepreneur, and an activist.
And we'll go to Kat.
Hi guys, I am Kat Zingano. I'm a professional MMA fighter, instructor, and a mother.
And Dea.
Hey everybody, it's Dia, also known as Dia Direct. I am a life coach. I'm a producer and a lot of dashes in between there, but happy to be here.
Thanks, Dia. And Dr. Rodriguez.
Hi everyone, I'm Dr. Daniel Rodriguez, or as some of my younger patients call me, Dr. Danny. I am a licensed clinical psychologist, and I work for Providence Medical Group in the Oregon region, in Sherwood Clinic specifically.
I'm so excited to be having this conversation with you all. I'm, again, Josh Cutler. I'm a licensed clinical social worker with Providence. And as COVID-19 continues to spread, a rise in mental health crises due to various stressors, including economic issues and uncertainty about the future, and isolation pose a particular threat to our communities. In addition to the physical toll of COVID-19, the pandemic has an equally troubling mental health component, causing anxiety and depression, among many other related problems. Emotional stressors like these can also affect a person's immune system, impairing their ability to ward off infections and other illnesses. Thus, it is as important as ever to address each individual's mental health as a whole part of their health when considering the COVID-19 vaccine options. So this town hall today will focus on how the pandemic has been affecting people's mental health, potential fears and or reasons for hesitation with getting the vaccine, and the hope that the vaccines could offer. The panel will allow participants to discuss the viewpoints openly and honestly, and thank you all for being here.
Thank you.
So it's been exactly 1 year this month since the time of the first COVID lockdown, which is amazing to me that we've been in this for a year. So whether or not that has affected your physical health, let's talk about how it's been for you on an emotional or mental health level. In other words, how are you really? So Kat, let's start with you.
So over the years I've been through a lot, in just life, and I've been lucky enough to have resources and seek resources and try to figure out the things that I need to do in order to be my best and my happiest. And one thing that I figured out was to be active physically, to sweat, to get my endorphins going, to have some kind of physical outlet where I'm like creating and building. And for me, that looks like martial arts. So that's going and hitting mitts, that's going to a jiu-jitsu class, and going toe to toe with people that have the same amount of will that I do for the day, doing boxing, doing lifting weights, strength and conditioning, all of that stuff. And all of those were shut down. It was something that at first I felt a little relief, because it was like this forced break and no coaches could call me and tell me to get off my butt and go do something and put down the Cheetos. Like I literally I didn't have to tell anybody no, because no one could ask anything of me. So, but after a few weeks of that, it really started to creep up, and I was like, I don't feel good. Like for a while, I was happy to be with my own thoughts, and to just be thinking about things that I know that I have been able to use distractions from thinking about. And I was like, cool, well, I needed this time with myself. That's good. But then there was like, okay, that's enough of you. I need to do something. So, even going on walks or looking out the window or trying to get some fresh air felt like such a luxury. And I felt happy to be a natural introvert, and I was having a rough time watching people that were definitely more extroverted than me having a harder time that I didn't understand, because I do like my alone time. And that it just made me scared for people. You know, it made me scared for like my kid. I have a 14-year-old boy, and they need other kids. You know, they need to be running around and saying their jokes and burning off their energy. And like, you're at different energy levels when you're 38 and you have a 14-year-old and they're going through puberty. And my boy's getting ready to be a freshman in high school, which is also a huge milestone. So it was a lot of letdowns, a lot of things not going as expected. There's you know, lots of chances to be resilient and have good talks in there, but it was definitely a change and something that got longer and longer. You know, I think all of us kind of expected this to be a 2-week thing at one point, you know, and here we are a year later, still figuring out, putting our toes in the water and making sure that it's okay. So, you know, it's been a lot, ups and downs. Once gyms started opening up and once I was able to start working towards my career goals again, I definitely felt an appreciation for it. And I felt really good about moving again and having some of those things still not completely normal, but at least something to have as an outlet and something to have to look forward to every day to go do that was hard or creative or whatever. But it was very tricky at times. So I'm happy we're coming around and everyone's starting to, you know, level out.
Thanks, Kat.
Yeah.
How about you, Veronica? How are you doing? Can you tell us about how this time's been for you?
I feel like I have similar feelings to what Kat was saying in the beginning. I'm an introvert, so the whole time, this whole lockdown, I didn't mind one bit. It actually allowed me more time to kind of do the inner work that I've been longing to do and I haven't been able to do because of work. And so, but I will say that in the beginning, like I think in the first week or two that we went officially on lockdown, I was sick. I got sick with COVID. So like the entire month of March into mid-April was like a blur to me. And I was living with 3 other roommates and I was in quarantine, isolated in my room. And we had like a whole system. So they were like, I come and drop something for me in the hallway. We'd wait a couple, you know, minutes. They would leave. I'd come out and get it with what little energy I had. I was literally bedridden for like 2 weeks. I never went to the hospital because this was at the beginning. It was also like the scariest time to go to the hospital. I'm from LA, so and I'm in New York, you know, so I'm like I don't even have like real family or even like close enough friends. But I think during that time while I was sick, I was like, you know, it was just one of those things where I didn't know, I wasn't sure. And I think when I came out of it, I was inspired more so because of like processing this new normal. And I'm a model, I'm a public figure, I'm on social media. And so I kind of like just got busy and I started creating spaces, virtual spaces for me and my peers or anyone who's just experiencing like, you know, like going through it by themselves. Like we were trying to like provide like a kind of like a community group weekly. And we did a series called Healing Together. So I personally, when I get asked about it, I feel like this is like the best year for me in my personal growth. And I think that I got lucky because it really like slowed me down in my career and like allowed me to focus on things that was really important to me. So yeah, like I see like everything, you know, I lost a brother. I lost so many family members, but there's a lot of beauty in tragedy. And so I'm kind of like just trying to kind of move with that spirit.
Thanks, Veronica. How about you, Daya?
Dia, yeah. So no worries. So I definitely have mixed emotions. Let's see. I gained weight. I definitely ate my emotions for a while. And, you know, being in the house like this, with my husband, that's been challenging. Just moments like this, like being on Zoom and being interrupted and, trying to have serious conversations. I think it's one of those things where you can't take yourself as seriously, and you've got to just remember what matters the most. So I don't think I experienced any depression, but I will say that I've been going through perimenopause, and if you know anything about that, it makes you highly irritated. Your body is changing, you're just changing, you're going into a different phase of life. And so I think that, coupled with COVID, has been challenging, and just really learning to embrace where I am now. And I think just in general, that's a good life, teaching moment, like be where you are versus where you think you should be. And really my saving grace has been long walks and candles. Aromatherapy, can't live without it, or at least I don't want to. And then just getting outside and walking. I happen to live near a park, and it makes a big difference for me. I'm an only child, and while, I'm probably categorically an extrovert, I find that in this season in my life, I'm becoming more and more of an introvert. I enjoy my alone time. I find it to be sacred. And so taking those long walks to just get in touch with myself, my spirit, my mindset, calm down, all those things, step away from the computer, definitely have, computer fatigue and all that, and just, really over being sedentary. And so, I'm ready to get my body back, really mindful about my mind more than ever, especially when you start to see that things get under your skin differently, or your reactions are different. Then it's like, okay, what's going on? And finding those moments of, what works for me. And in this case, nature and the park, and just kind of, I don't want to be close to anybody. So I think for a while I was a little bit of a germaphobe, which I've never been. But finding those ways to get outside, not overdo it in terms of the closeness, even going to restaurants, sitting outside, those things give me joy. And so I think I'm good, but I'm also very aware, and I'm aware of triggers, and that I'm more sensitive to triggers as a result of life changing in the way that it has, if that makes sense.
Mm-hmm.
Yeah. I'm curious, what's your favorite candle scent?
Ooh, right now, my favorite candle scent is, I think it's called Palo Santo. Yeah, it's really good. It's very earthy. I like woodsy smells. I like more masculine smells. I really love patchouli, things like that.
Do you burn like real Palo Santo?
No, but do tell.
It's amazing. It's
yeah.
Yeah.
It cleans the air energy. That's probably why you like it so much.
Mm-hmm.
Wonderful. Well, Dr. Rodriguez, we had a question for you about what do the statistics tell us about the changes in the public's mental health over the past year?
Yeah. So thankfully, we're starting to get more and more data to kind of give us an idea of what trends are looking like across the country. And obviously, it's hard to capture all the different people groups and nuances in such a diverse body of people. But recent study from the CDC put out in late August indicated that amongst about 5,400 participants that responded, 40.9% of them reported at least one adverse mental or behavioral health condition within the past 6 months as a result of pandemic fatigue, stress about COVID-19, with specifically our BIPOC communities being disproportionately represented in those numbers across the board. Black and Latinx groups were reporting higher rates of anxiety disorders, depressive disorders, substance use disorders, either worsening or starting a substance use habit during this time period. So we're just kind of seeing that it's really hitting us hard. and having an adverse effect on our mental health in lots of different ways.
How about at Providence? Have you noticed just in your day-to-day clinical work, if there's been a change in patients' mental health needs?
Yeah, absolutely. So in my own clinic, we've seen a significant increase in the utilization of behavioral health services. So traditionally, my primary care clinic is kind of a medium-sized clinic, and traditionally we've operated with one full-time behavioral health provider and two trainees that are supervised by the licensed psychologist. And we're seeing more referrals than ever, more referrals from our physicians related to concerns of anxiety, depression, substance use, adjustment disorders, kind of a wide range. Many of them related to complaints of isolation, loneliness, just lack of ability to cope with the stressors that they're dealing with. Just a lot of the things that have been said already today is that people had been operating and probably had a certain amount of stress in their life, and then add in this global pandemic along with just kind of the social upheaval of the past year and take away their ability to cope. And this is kind of what we see is just people needing more support and services. And it's definitely been reflected in my work at Providence.
So wanted to shift to talk a little bit about how mental health is impacting our families and communities. So wanted to start with you, Dia. What are some of the things that you were unable to do in your life that you used to do, and how does that affect your mental well-being?
I'm really glad that you asked that question. And let me say it like this. So I have a podcast called Superpower Her. And so I tend to have conversations with women of power or with powerful stories. And lately I've been interviewing a lot of therapists. And one really good gem that I got that speaks to your question is about grief. And I learned that you can grieve anything. So some of the simple things that I miss, are, gatherings with friends, going out to eat, think just social things really. But at first you feel shallow for missing those things because of the height of tragedy and the intensity and, all of those things. So really being able to have tools and get information, sometimes just knowing that how you feel is normal helps. And so in this case, learning that you can grieve anything. It doesn't have to be that someone died. It can be that you're grieving going shopping. It sounds shallow, but that's your truth. And so just having, something to call it, helps to normalize it. And then you're less judgmental about what you may be feeling. And then it gives you a tool to know what to do with it. Okay, this is normal. I don't have to judge myself. It's okay to miss these things. And at the same time, it's also taught me to appreciate and realize some of the things that I thought I had to have, some of the people I thought I should be around. I don't. And I'm better for it. I'm less engaged on social media because it just didn't serve my spirit well, even though I use it for business and socially. I gave myself permission to not do things that didn't feel good for me because maybe it caused anxiety, or maybe it made you miss some things that you used to be able to do. So this season has allowed me to check in with myself, really identify, what's going on, and miss some things, but also realize there are some things I don't really need and I don't miss as much. And, there are just some unnecessary expectations, even socially, that I would put on myself that I really don't plan to pressure myself about. If I'm feeling it, I'm feeling it. If it feels right, I'll do it. If it doesn't, I won't. And really making sure that it's serving me well and serving my spirit well versus just feeling like these are things that I should be doing because I'm going to miss out. Like, FOMO, like no FOMO here, in this case, no more fear of missing out. COVID has totally cured me of that.
Well, thank you. There's definitely been a fair amount of silver linings in my life as well, and it's important to reflect on those. So Veronica, I know your work in advocacy is really important to you. How has that been affected during this pandemic, and what sorts of changes have you had to make?
It actually didn't affect it at all. There was so much that was happening throughout this whole year, especially with George Floyd. It really required me to have to get back into, into the advocacy work and get more creative with how we build using the social channels. I think that in a lot of ways we had to reimagine what community building looks like and what happens when you really do use the internet in your favor to connect people from all different parts of the world, especially me being from the South Pacific. It really required me to figure out how I can be more present for my own community and learning how to be more in solidarity with everything that was happening in the world and to the Black community. So it actually wasn't affected at all. It actually really put me back into alignment with a lot of the core and how I started before I even got into modeling. So it was perfect timing, literally. It was not that the situations happened, but just the timing of it all. I wouldn't have been able to do the advocacy work if I was still working as a model. I find myself even now that things are starting to slowly go back to normal, that I'm having a little difficulty trying to balance the two, but I'm trying. And yeah, I wouldn't say that it was affected at all. It actually just propelled the work and the priority of the work as well.
Thank you for sharing those positives. So Kat, how has the pandemic impacted your career and your training?
It was very different, and it was, I did take a fight. I had a competition in September where it was crazy. I thought I'm very, very particular and like ritualistic with my training. Like everything needs to go a certain way. I eat at certain times of the day. I stay on a schedule. I stick to it. I don't move from it. Or those are things that I think about when I'm walking into the cage. I'm like, oh man, did I cut a corner here? Did I go hard enough that day? Or did I have the right training partners? Did I eat right? Did I, do all of these things? I have this kind of perfectionist boxes that I have to check before I feel confident going into these things, let alone the nerves and everything that already goes into it, because you're fighting other people that are trying to win also. Camp was completely different. Normally I have a ton of training partners, and I go to a facility and I get a lot of different looks at a lot of different people, which gives me so many opportunities to problem solve. With this, I had to stick with a facility with one or two people the whole time, and the people that could be around me that couldn't, that were also kind of hermiting down for sure, that I could count on the fact that they're not going to be around people, because if I in fact tested positive, not only was it, I didn't want to be responsible. I feel like I would have been okay, but I didn't want to potentially be around people that would not have been okay. And on top of that, if I did test positive and I show up to my fight that way, I get sent home. So all of that work would have been for nothing. And that's how I make a living. That's how I take care of me and my son. So having totally different training camp, less training partners, you don't get, there's no one in the crowd. You don't hear the sounds, which I also liked, because it was, sometimes the crowd can be crazy at these things. So it was really actually nice to fight in the quiet. But being quarantined when you get there and having to figure out how you're going to lose the weight from your hotel room versus going to a sauna or being able to go run. Lifting weights was you know, at times giant 5-gallon jugs in my living room on a carpet floor, which I don't know if you guys like sweating on carpet, but I think it's pretty disgusting. Uh, and yeah, it was totally crazy. And actually getting to the competition, getting to the fight, I was very happy to see so many other fighters that had done it before me. And I'm like, there's going to be a before, which is what I'm experiencing right now. And then there's going to be an after where I'm going to know what it's like and I'll be able to calm down. But right now, this is uncharted for me, and everything that needs to go this certain way that it always needs to go is definitely not going that way. And I'm happy because it showed me, no matter how nervous I got, no matter how out of control of sorts that I felt, that like just putting one foot in front of the other and remaining curious about what each day is going to offer. And like, everybody's doing the best with what they have, you know, and that's it, like, period, hard stop, that's it. Like, there's nothing you can do. Everyone's got the same problem. As nervous as I was getting, or as like dysfunctional as some of these days felt, I knew my opponents felt the same way. They were going through the same thing. They were having to figure out how to work out in a living room with their couch instead of training partners too. So it was very like, I don't know, I guess we'll see. Every day it was like, I guess we'll see, you know. And my fight turned out okay. I definitely felt strange and weird going into it, and it was so different, but like I came out on the other side and I get a look back, it was like, okay, well, actually I got to learn a lot about myself. So there's a win there. And no matter how that fight would have gone, it wasn't my favorite. I did get the win, but no matter how that fight would have gone, like, that was out of my comfort zone and out of my control. And it was still such a good thing to get through and see just that patience you have to have with yourself and with the world. Like, there's nothing you can do. If I want to get that paycheck and I want to continue working towards my goals, like, this part has to be uncomfortable right now, and that's it, period. There's nothing else to do about it except live uncomfortably and show yourself later what it was all about, you know.
Resilience is all about. Thank you. So I also wanted to ask, you mentioned you have a son. What about at home? My daughter's upstairs right now in her virtual classroom. I was just wondering how you guys are doing with school at home.
We're good. At first it was kind of crazy. Like, we're not used to just having our kids home all day. And when they're bored and they're like, mom, I'm bored, mom, I'm like, you're like, these are usually hours I have that you're at school and I'm at home and I get to train, and now I got to figure out like what, you know. So at first I just felt like, you know, it's like, it's awkward roommates, you know, almost. Then we got into some great conversations, like stuff that I don't know that we would have had because we just didn't have the time. Like, it's not even not have the time, but you don't even know you need to make the time because life is just on such a cycle. Like, these days you have this sport, this other days I have training, this day, you know, we know you do your homework, and then these days we try to have your friends over, or we try to do something active, or we try to, you know, like, you fill up those days with so much that you don't always stop to sit and like think to get to ask each other all these questions, you know. And so we had some great communication, and I felt so much closer to my kid. We found a way through one of my gyms, especially because he's a freshman and he's a boy, and just like was nervous. He's always been kind of short. He's always been little compared to the other kids. I started him, he has a July birthday, so it was either start him late in school or start him young in school. So I started him young, and that made for him to be a little smaller than everybody and just develop a little slower. And this summer he wanted to lift weights and get ready for his freshman year. And so I could like connect with him over that, because I'm like, I lift weights, I can help you lift weights. And he wanted to get buff, and he wanted to like work on muscles, and wanted to, you know, do all of that. And it was like a big letdown for him to do all of that work the whole summer and school just not start, and all the sports didn't start either. But from January last year to January this year, he put on 5 inches in height and 33 pounds in weight. And it's like, I swear it's all the sleep and it's all the food and it's all the rest, and just like, his body just got to do its thing, you know, and it wasn't, like, that's a huge deal. And he's like pumped, like he's proud of himself. He likes his muscles, he likes his height, like he's taller than me, he can pick me up. I don't know if you guys remember, like, I don't know if you ever tried to pick your mom up, but if you ever did, I'm sure it was a big deal. And like, he's pumped, you know, and like, that part between us was really good. I think I'm curious with this, if there's going to be a social awkwardness as far as going back to school. Like, for us, it's a year out of our lives, but to a teenager, that's a percentage, you know, that's a percentage of their life that they're stuck at home without talking to other kids. And a lot of their socializing was video games, and they are not nice to each other on there. It's not cool. Like, these kids, they're mean and they're frustrated. Like, that doesn't feel happy interactions. That's only competitive, and there's no accountability to what they're saying and doing. So I'm excited for him to get around kids again and to, you know, do whatever he does with all he worked on. But I am curious what this generation of kids is gonna, how this affects, if it does affect them differently, and what that ends up looking like.
Well, I'm glad that you two are closer. I'm noticing the same thing with my kids. It's certainly the first few months were really crazy, but lately I'm imagining that I'm going to be really missing my daughter when she goes back to school soon. So Dr. Rodriguez, how does prolonged living with the kind of stress and trauma brought on by the pandemic affect people over the long term?
Sorry, I was on mute there for a moment. So, well, I'll try to make this as brief as possible, because there are so many ways that prolonged stress and trauma affect us. So essentially, when we're under stress, our body releases a hormone called cortisol, which functions as, which has been dubbed the stress hormone. And it interacts with a number of different cycles in our body to give us energy and to kind of keep us going. But when that's constantly on, that becomes a problem. So like, it affects our immune system. So not able to fight off just normal infections or germs as well as we normally would. It also increases, like, it interacts with other hormones in the body, which increase our likelihood of developing like chronic health conditions like diabetes or hypertension. Gastrointestinal issues, so it'll interfere with, like, if you have IBS or other issues like that, and you'll notice those symptoms intensifying. Obviously, our nervous system it goes haywire too. We feel more of that anxiety, more of that physical agitation, and then with trauma, we see like the fight or flight system activating, or the fight, flight, or freeze system activating. So our body is producing these large amounts of adrenaline, so our heart is pumping. We're feeling these feelings of dread and impending doom, like flop sweating, you know, chills, heat, all this, because our body thinks that we're in imminent danger, even though we may not be at that moment. We're feeling it, and it makes it really hard to be able to function when we're operating under like all these different systems that our body is putting into play, when it's really inconvenient to do so. Like if you've ever been like on a Zoom meeting and trying to pay attention for work, but it's hard to concentrate. That's because of all these different systems are firing, and you just don't have the capacity to function like you normally would. Even things like libido are affected. So arousal or ability to get pregnant, all those things are affected by chronic stress and trauma. So a lot of these overlap with like not just COVID-19, but also the experiences of historically marginalized groups in the United States. So there's a lot of interchange here. So a lot of these are compounding the already existing issues that have been present. And so we're just kind of seeing it on a bigger scale than we have in a long time.
Josh, can I respond to what Dr. Rodriguez was saying? Because everything you said was phenomenal, and I'm really glad that you did, because I think one of the things that came out of this crisis is really looking at the holistic impact that mind, body, and spirit have, as well as connecting it to the social injustices. And so just really being able to see how one thing is not a silo. It all connects. And, this situation has exposed a lot of that, I think, from a socioeconomic perspective, from a mental health and physical health perspective. And so just, holistically, no longer can we just look at things alone. No longer can we really just put things in a category and judge it just based on what's happening. There are causes and effects, there are reasons. And I think it's opened us up more. I know even many medical doctors are already on that journey of not just looking at how to treat patients from a medication perspective, but really looking at, going deeper and how all these things are connected. And now they're also having to, address that, what's happening in your brain can be impacting your heart, or vice versa. All of these things are connected. And so, that's the gift, to your point that Veronica said, sometimes, there's beauty in tragedy. And if it reveals, how we can do life better, even from an environmental perspective, realizing that we need the environment. We need to be outside more. We need sunlight, and how sunlight does affect your mood, all of those things. People who would not normally pay attention to those things because we're just too busy, or there's no reason to even seek the information. I think now we're able to look at ourselves and life and our approach to life and others differently from a holistic perspective.
Thanks, Dia.
Thank you for that, Dia. Can I just say something real quick, Josh?
Yeah.
Yeah, thank you for that, Dia. That's so important. And I think that in my own training and I hope as I supervise other students that are coming up and across the country, that we really are aware of what we call the biopsychosocial and then add in spiritual model of health, recognizing that these are all aspects of people. So there's not only the biology, the part that is going on with the person physically, but there's also the psychological, there's the socioeconomical, and the spirituality piece too, whatever someone's spiritual journey may be. All of those things are interacting to either help the person function as well as possible. But if there's something out of balance, then that tends to have ripple effects across the other ones as well. So it's so important that that not just in behavioral health, but also in physical health, that we're working towards recognizing people as a whole person.
So I wanted to shift gears a little bit. Speaking of health, talk a little bit about the COVID vaccine, which is sort of being heralded as the light at the end of the tunnel, but then it's also been causing some stress for folks as well. So I wanted to start with you, Kat. What are you hearing from others about getting the vaccine when it's available to them, and what's giving them hope or causing concern?
Oh man, it's crazy, that it's become so political, and I understand why, as far as decisions and people doing, what they want and what they feel appropriate is for their own body. So I've felt on the fence a ton, because like everybody else, I want to be part of a solution. I want to see what I can do to contribute to how this whole thing ends. But I also have a really hard time wanting to do something that is not been tested for very long. So on a personal scale, last year, I guess a year and a half ago now, I had a breast explant surgery because I had an allergic reaction to these implants that I had, and I'd had them since 2010. And I had no idea what was wrong with me for all of these years. So sick all of the time, allergic to every food, constantly sore, inflammation, depression, anxiety, like all of this. And I'm going to the Mayo Clinic and dropping $20,000 out of pocket to have them do everything on me, from head injuries to like infections to dairy, you know what I mean? Like anything. And I'm trying to figure out what's wrong with me, why my whole endocrine system is messed up. And I finally stumbled on somebody that literally had all these same symptoms, but she had figured it out and had taken out her implants. And I was just like, I have to know, like, I have to know if that's what it is. That's probably the last thing I haven't tried. And I did, and I got them out, and like, everything's normal, everything's better. And it took a year, you know, of my body detoxing. And of course that part wasn't fun, but like all my blood work is normal. I'm happier, I'm healthier. Like it's hard because sometimes I don't even remember how bad I felt because of all of the things I can eat now too, you know, like it's crazy. That being said, I'm very scared and hesitant to go into putting another thing that's this time, you know, you can't remove it from your body, you know, and if I do have a reaction, or if I am not as healed as I feel and look to be, what is a bad COVID vaccine experience going to do to me? My sister just got the vaccination 2 weeks ago, and her face is still numb and droopy on one side. She got Bell's palsy, and that's tricky for me because it hasn't gone away yet, and I'm told that it can go away, but the fact that it hasn't is, you know, obviously concerning. I know, I think it's debatable what happened to that professional boxer. I know that some people were saying it was rather coincidental that he passed away right after getting the COVID vaccine. But then, you know, there's the other side where people are saying it could have been prior health with his heart. So I guess the moral of my opinion is that I want to, again, be part of the solution. But I think personally, especially being the only parent to my son and knowing I need to be good and present for him, is I think I will wait and maintain staying away from people that I could negatively impact. And just let everything get figured out a bit more. I think it's amazing more people are getting vaccinated, which should make it less of a big deal if I am or not, because if you are successfully vaccinated, then I mean, in theory, I can't do anything to you, but also I'll still want to be careful. But I just need to see more time go by and more research and just more consistent results that are a bit more predictable before I can make a real educated answer or even a real educated statement, because I want to respect everyone in saying I don't know enough. Like I'm uneducated on how all of this is going, and I would like more information.
So Dr. Rodriguez, you're a caregiver working within a large hospital system. I know you work in a clinic as well. Do you generally think of the vaccine as a beacon of hope for others?
I do. I see it as a beacon of hope in, as like I mentioned, I do work in a clinic, but then I also work very closely to providers. We have an immediate urgent care in our clinic. 10 minutes down the road is a hospital with an emergency department. And then 20 minutes the other direction is another large hospital in the region. And just how at capacity our hospitals have been, you know, has been tragic and alarming. I mean, I now have countless stories of patients coming to me for grief, for grief therapy treatment, essentially because they have lost a loved one to COVID-19. And I think that personally, and many of my colleagues would agree that especially the people that are at highest risk, my patients that are immunocompromised or 65 and older, if them getting vaccinated in particular, more of our providers being able to get the vaccine as well, to limit our risk of passing on anything to our patients, very much is hopeful. And I think that I keep hearing from patients, and this, of course, this is anecdotal, but I keep hearing from patients like, well, it's, 2021 started rough, but, we're kind of getting back on track. I think people, like with the change in the seasons, and then also with news of the vaccine becoming more widespread, I think people are starting to feel a bit more hopeful. And I hope that that continues to be the case.
Great. So how about you, Veronica? Are there people in your large family that you haven't been able to see over the past year? And how's that been for all of you?
I've actually had multiple funerals throughout the entire year. And so I actually, like 3 of them, I actually flew back to California for, because they were family members that I was really, really close to. And then I've also had a lot of family members overseas pass away as well. So I actually, like, I definitely got on that plane. I went to go be with my family and be with my parents. So it was kind of crazy because of the year that we had. It was actually the most times that I had ever traveled home throughout the year. So again, it's like that bittersweet moment. It brings everyone together, but it's unfortunate why we're together.
Sorry you've lost so many people this year. So are there varying feelings amongst your family regarding the vaccines?
I actually think that my parents are scheduled to take it in the next 2 weeks, which I'm completely fine with because they both have underlying conditions. My dad is a cancer survivor. And so I think it's something that I would definitely encourage like amongst the elders in my family. I don't think that they're opposed to it.
Okay. How about you, Dia? What are some of the feelings you've had on both sides of the coin about getting the vaccine?
My mom and stepdad have both been vaccinated, and so she's going through the some of the symptoms that you get now. So we talked yesterday, and she wasn't feeling that well. I think she took a nap, and later on in the day she felt better. So, but you get that information, so what to expect. So I've certainly, both colleagues and family members who have been tested. I haven't yet. Most of them have experienced a little bit of illness afterwards, but then recovered. I definitely am of the mindset that I want to wait and see. Not that I won't do it. I'm pretty sure I'm going to do it. My only approach has been, I don't necessarily want to be one of the first. Let me just kind of see. I'm going to do it, but let me just watch a little bit, let me see. I know we don't have enough information. I don't want to be irresponsible. And certainly to, in some situations, it might end up being mandated, to go into certain places or work or whatever. So you want to be able to function, as much as possible. And of course you want to be healthy and safe. But I do think the need for, a continued campaign and really speaking to some of the concerns and theories and misconceptions that people have, it's going to take time to get people comfortable. So as important as it is, as much as people want to get back to normal, I think we, as a society, we have to be mindful, again, what we talked about earlier. There's not one reason why somebody would or would not do it. There are several. There are historical reasons, there are societal reasons, there are mindset, all of that, and so I think we just need to speak to, the medical community in particular needs to speak to those things and address those things versus just telling people what they need to do. You've got to know people's why. And then, it's not about what you're selling, it's about what people are buying, right? So what do people believe? What do they understand? And so I'm right there in the middle. I get it. Intellectually, I get it. You know, emotionally, historically, you kind of like, you know. And guess what? I just don't want to feel bad. Like, I don't, like, who wants to feel, you know, nauseous and all those things? But I do believe that the good outweighs the bad. And I give myself permission to have different thoughts about it. And ultimately, I trust that I'm going to be responsible and make a healthy decision for myself, my family, and my community.
Thank you.
Josh, can I add something?
Yeah, sure.
Yeah, I just want to add to what I said earlier, and that while I see it as a beacon of hope, there's so like nuance is the name of the game. I think you know, rarely are things black or white in life, and that's something that I work on with my patients all the time. Is that it's not all or nothing. There's usually an in between, and I think that there's going to be people that fall on the side of the spectrum that I'll probably get it, but I have real concerns, and that's valid as well. And then people are saying like, I probably won't get it, but it's good that other people are, and those are very real, valid opinions. And it is important for the medical community to touch on history, because unfortunately, medical systems have a pretty checkered past of mistreating particular groups. I mean, you name the Tuskegee syphilis studies for one, and forced sterilizations of women in the late 70s and 80s, and so I think it puts the onus on us and I count myself as part of the medical community because I'm part of a large medical system, to educate, to provide information, to have discussions like this, recognizing where people may fall on the spectrum, and really recognizing that instead of just bowling over or ignoring those concerns. I think that ability to sit and listen to someone's story, someone's concern, someone's context is going to be very important throughout this whole process. So
I have a question. How do you feel about what people are saying, how the government cannot be held responsible if anything does happen with the vaccine? Like, I want to know, what do people like you in the medical field feel about that, and how do you advise patients? Like, basically, this something, it's not mandatory yet, although it is mandatory in certain parts of the world, and you can still have the free will to choose, but just be alarmed that if you don't do this, this could happen. Oh, and also, you can't blame us if something does happen to you. Like, how, to me, that doesn't make sense. So I just want to know, like, how do people like you feel, and you guys are the actual practitioners, you guys are in the field advising us, the public?
yeah, that's a great question. So I think the most important thing with situations like that is informed consent, which is just from the get-go, making sure that people have all the information that there is available, not hiding anything. It's the same thing when I enter into treatment with someone. I say, like, this is kind of the role that I play. This is what I do. I protect your confidentiality or privacy. But if you tell me about, like, you're going to harm yourself or someone else, or there's abuse happening to a protected population, that I have to report that. I see that kind of as the same way, is like laying out the framework so that they know they have the information, and they choose to proceed with working with me. As for with the vaccine in particular, I have my own I have my own just kind of going back and forth about that. Is that just kind of the statements of not being able to hold somebody accountable for it, and that's just something that I and other professionals have been wrestling with on our own. I wish I had a better answer for you, like, as far as that. But I think that in absence of being able to have an influence over that in particular. I think that just information and education and just all the facts available at the get-go are going to be important for whoever is making the decision to get the vaccine for themselves.
Yeah, I like what you said about informed consent. That's really key. I actually I'm on the medical staff of one of our hospitals, and so had the opportunity to get the vaccine like the first week. And they weren't forcing us, but it was like, your number's up, take it now if you want it. And so I remember waiting in line with all of these providers who had been really on the front lines. I ran into an ICU doctor that I know well, and he was working to get all of his docs vaccinated. And for that group, it really was a beacon of hope, but also seeing how tired people were. My experience so far with it was I got a little sick after the second shot, got a day off in bed, but otherwise have been okay, just for what it's worth being a guinea pig. But so we're needing to wrap up, but I just wanted to see if anybody had any last thoughts. This has been a really meaningful discussion. I want to thank all of you for participating, but any last thoughts?
I would just say, thank you also, Josh, for your transparency, as well as you, Dr. Rodriguez, because I think it's those kinds of things that will help people to trust the process a little bit more. Like when you're not being dogmatic and you're able to say, listen, I've had some thoughts or some feelings, or yes, I did get sick, but like just prepare people for what to expect. And also, to the degree that you can share your own journey where you're comfortable, I think helps people, and it helps people trust also the information that you're sharing, because you're not just going by the script, if you will, but you're being responsible as a human first and also as a professional. So I think that's helpful, and just more of those kinds of stories. The full spectrum will help us all be more educated and make informed decisions that way as well.
Yes, I'd also like to say thank you as well. It's been a pleasure of mine to be here in the space and be able to learn and figure out how I can reframe my message as like one of these young bucks in the generation who is influential, whatever little I may know. But I appreciate you guys for all you guys offered and the value in this conversation as well.
Yeah, same. I think it's nice that you guys are looking at it objectively and letting people have doubts and letting, opening up dialogue for it to be a fair and safe conversation. And because right now there's a lot of walking on eggshells going on in communities, because we're a lot of times being led by the media, which you can't fully be sure if you're supposed to be trusting. We haven't been able to really connect and be around our close family and people that we normally rely on and talk to. I mean, other than, Zooms and FaceTimes and things like that. So, to be able to share fears and experiences and stories and, have that be okay and have it be normal I think is going to make people feel a lot more safe in getting educated, because it's not just getting shot down and told you're wrong, I'm right, or I'm, wrong, you're right, whatever. So I think that's healthy and good steps towards, making a comfortable future for people. So thank you too.
Thank you.
Thank all of you. And thank you, Josh, for facilitating, and thank you, Veronica, Dia, and Kat, just kind of hearing each of your stories and your perspectives. And yeah, I know that even as a provider, my perspective is limited, and you three have platforms and are working with people directly in different ways. And I feel like I've learned a lot from each of you today. And that's, I mean, hearing people's stories, like learning is a big part of what I want to do, and building bridges and helping people have the information they need to be able to make healthy decisions, healthy changes in their life. So thank you all for your time today.
All right, well, that is the end of our time. Thank you all so much. This was a really meaningful conversation, and I look forward to seeing where it goes. Take care.